Medicine in California. He's a professor of cannabis education at University of Sciences and consults for cannabis companies and individuals. Dr. Morgan has recently given presentations to Pennsylvania's Secretary of Health, the head of the medical marijuana program, and the Pennsylvania Pain Society. He has practiced drug and alcohol rehab medicine and has been involved in drug development. And I would like to say Joseph is a good close personal friend of mine, and a man who is filled with compassion. He helped me with a friend of mine years ago who was suffering from severe colon cancer. Talked to him for an hour over Skype about how he might be able to use cannabis to help alleviate some of his pain. So, and I know he is a man who is deeply interested in the medicine as well as the spiritual aspects of cannabis. So, Dr. Morgan.
Thank you, Scott. I'm going to ask those who are having conversations on the side to either keep your voices down or go outside, because this is a very serious talk on cannabis and addiction. Addiction is something that doesn't just affect those who are shooting heroin. Addiction is something that affects about 50 to 80% of the population. Okay, I'm going to ask again, people who are having loud conversations to please keep your voices down so those who want to focus can. Okay, so this talk is a version of what was presented to our Secretary of Health, and it's a version of what was filmed by Greenfield-Blau Media a couple months ago and is coming out in about a month on Greenfield-Blau. This is an original presentation, an original model of addiction. I practiced drug and alcohol rehab medicine early in my career and have personally struggled with addiction for about 40 years. Cannabis for me has been both a problem as well as an exit from my own addiction, which I'm going to go into. So my original concept is that addiction is a bio-spiritual dis-ease, and cannabis is a bio-spiritual remedy. Next slide, please. Among the other components of cannabis besides the cannabinoids are the terpenes, the essential oils, which have interesting qualities. So, for example, linalool is sedative and it helps with anxiety. So if anxiety is a component of addiction, cannabis containing linalool can help. Likewise, if muscle spasms and tension are a component, such as with alcohol withdrawal or opiate withdrawal, then myrcene can be a component. Myrcene is also very relaxing. Next slide, please. So why are various things addictive? Why is food addictive? My addiction was food. I'm going to show you all the notches that I lost in my 70 pounds of weight loss, which began when I did my cannabis fellowship in California, and I was exposed to drug CBD, Charlotte's Web, even before it was called Charlotte's Web. That was the beginning of the anti-munchies, the beginning of the cessation of my own cravings for carbohydrates, for breads. And that was the beginning of a 70-pound weight loss for me that completely transformed my life. Now, conversely, I struggle with weight gain from THC. I'm a cannabis patient. My doctor is Dr. Jeff Pinsky in the back. And when I use cannabis for insomnia and my own PTSD, I cannot control my appetite. The medical literature says cannabis does not result in increased weight gain, and that may be true for the majority. But for me, that's not the case. I cannot control munchies. So it's a struggle. Okay, so is addiction a spiritual issue, a biological issue, or both? Is cannabis addictive? It's not such a simple answer. Is it an exit drug or an entry drug? Not so simple. Next slide, please. So this is the American Society of Addiction Medicine's definition. I practiced addiction medicine, drug and alcohol rehab medicine, very much under the influence of the American Society of Addiction Medicine, and I think that this is a useful definition. So addiction is a primary and chronic disease, which means no matter what else is going on, addiction is a response to PTSD, which it is for so many people. Addiction itself, separate from anxiety, separate from depression, separate from stress, separate from inability to cope properly with adult life issues, can take on properties of a primary and chronic disease which needs its own treatment. And there are functions and circuits involving brain reward, brain motivation, learning and memory, and there are characteristic biological, spiritual, emotional, psychological manifestations. Next slide, please. So the ASAM definition continues. Addiction is characterized by the inability to consistently control and abstain and deal with impairments in behavior, and also that there's a diminished recognition of the significant problems that a substance or substances or behaviors have with relationships and function. It's therefore dysfunctional, and it's a chronic disease, and it has cycles of relapse and remission. Any mystery here? Yeah. Next slide, please. Now, I like a very different definition of addiction that comes from Alcoholics Anonymous. Because Alcoholics Anonymous is, I think, the premier organization that has helped both pioneer addiction studies as well as treat so many suffering from alcohol, and other addiction can be thought of as just solid forms of alcohol. So I'm just going to read something from the AA, official AA pamphlet, What is Alcoholism, and just substitute, if anybody here struggles with any addiction, what is your addiction when I read about alcoholism and drinking. Alcoholism is a progressive illness which can never be cured, but like some other disease, can be arrested one day at a time. It represents a combination of physical sensitivity to alcohol and the mental obsession of drink. Regardless of the consequences, it cannot be controlled by willpower. Okay? People. So now I'm going to go on to another definition. Another definition which comes out of this book, God of Our Understanding, Jewish Spirituality and Recovery from Addiction, is that the drug of choice is not the addiction, it's the solution. The addiction itself is something internal. It's isolation, it's anger, it's frustration, it's pain, it's stress. That is the addiction. The drug or the behavior is the solution. It's the only solution a person has found. It may be a costly solution, a toxic solution, but it's the only one that works for them until they find a spiritual replacement. And as proof, if addiction was just a chemical toxicity, going to detox, getting the drug out of the body, is all that we need. Well, that doesn't work because then people go back even though the drug is out of the system and there's no more withdrawal. And if you don't have access to the drug, you're miserable. You're a dry addict and a high relapse. So what is addiction? And I'm just going to read a little bit more besides it's the solution to the problem. It has to do with unburdening ourselves of our emotional pain. It's how we get in touch with God's purpose for our lives and God's plans for our lives. That's the essence of dealing with addiction from a spiritual perspective. There's so much more, and this book is also endorsed by Catholic priests and ministers and drug and alcohol rehab professionals. Now, the current treatment in addiction, one of the mainstreams is called MAT, which stands for Medication-Assisted Treatment, which is basically for opioids, a choice of 3 drugs. Injectable naltrexone, which will block, if you inject heroin or take oxycodone, it'll block the effect. But it also makes you miserable, and it's not effective. It's also indicated for alcoholism. Then there's methadone, also a Schedule II drug. And then there's the newest one, Suboxone, buprenorphine, which is also a Schedule II narcotic. So methadone and buprenorphine or Suboxone in overdose can kill just like heroin do. They don't address emotional or spiritual components. They're supposedly substitutes for heroin, but they don't address the core issues. Heroin was introduced as a cure for morphine addiction, and heroin is a very effective treatment for morphine addiction. When morphine addicts have access to heroin, they have no more interest in morphine. It's 100% effective. Unfortunately, the current FDA-approved 3 MATs are less effective than heroin is for treating morphine addiction. So I want to propose that cannabis is a form of medication-assisted therapy. It's not original. Some people have called it PAT, or plant-assisted therapy. Okay, next slide, please. So this is my view of addiction. It's a magnified self-obsession. What's going on in my head? How do I feel? It's intolerable. I have to change it. Or it feels great. I just want to have more and more of it. It's going to be the center of my life. That's already getting into a serious addiction. And it's an isolation. A lot of the inner themes are person is full of resentments versus gratitude. There's a lot of anger. The substance helps cope with anger. There's a lot of fear versus faith. Some of the fears could be if people find out who I really am, they're not going to like me. I carried a fear that, of annihilation anxiety. The world's going to disappear, and what meaning will my life have had? I mean, it sounds very silly now, but our own fears are so real to us. Pessimism versus optimism. These are all examples of the negative spiritual characteristics of addiction that spiritual transcendence addresses. And there's no magic how spiritual transcendence and spiritual things happen, but they just do if programs are worked and if the substance that causes the problems is abstained from and if there's support. So I think, and Dr. Pinsk and I have talked about this a lot, that a lot of addiction is a self-treatment for PTSD, anxiety, bipolar disorder, and depression. But a lot of substances and behaviors themselves are toxic. And then the toxicities take over from the therapeutic benefits. Alcohol is very therapeutic and beneficial for acute PTSD. But what about it in its chronic use when it can't be controlled? It's toxic. And the same is true for opioids and benzodiazepines. The addict cannot limit their use, the non-addict can, and that's the difference. But cannabis just doesn't have the same toxicities that these other substances do. So addiction impacts society, it impacts family. I want to point out Al-Anon is an organization for families and friends of addicts and alcoholics, and they point out their 3 C's. You didn't cause somebody else's alcoholism or addiction. You can't control it and you can't cure it. But you can work on your own serenity, and you can not let somebody else's addiction and craziness become your craziness in the center of your life, your codependency, so to speak. Okay, next slide, please. So this is a slide that I would encourage anybody who works in a dispensary to take a really close look at, because perhaps contact me if you want to have this up in your dispensary. It's my own copyright. But we could see 6 drugs of addiction and kind of how serious they are in terms of NIDA rankings, National Institute of Drug Abuse, as well as how many premature deaths there are a year. Now, cigarettes or nicotine just doesn't get the attention that heroin does. Heroin or opioids are only causing 70,000 deaths a year in the United States. Only, versus over 400,000 premature deaths from cigarettes. Except we don't have teenagers smoking their first cigarette and, dying with the cigarette hanging out of their arm, or out of their mouth. So it's not as dramatic. The top of the slide shows various parameters of addiction. Dependence is psychological. It's easier to get off of heroin than it is off of cigarettes. That's psychological dependence. What's the most intoxicating drug? It's alcohol. People commit crimes during alcoholic blackouts. They're so intoxicated, they can still function, but they don't remember that they carried out an armed robbery. And cannabis and caffeine most closely resemble each other. So in terms of safety, cannabis and caffeine are up there, except cannabis is actually a little bit safer. What is the most euphorogenic drug, according to NIDA? The one with the greatest pleasure association. It's cocaine. 8,000 deaths a year from cocaine. Okay, next slide, please. This is similar data in another way. Food addiction is what I highlighted in yellow. That's 365,000 premature deaths. I think it's actually about 10 times higher. About 2/3 of the population is obese. High blood pressure. I'm not going to go into all the diseases related to food issues. You can ask Skip or myself if you have any questions about it. It's a private joke. Next slide, please. The whole point of this slide is that cannabis is so safe, you can't overdose fatally as compared to alcohol. Next slide, please. Now, Felicia introduced the endocannabinoid system, which is a physiological system responsible for how we relax, eat, sleep, protect, and forget. Well, it's very important to forget, because if we remembered all of our traumas, we would be completely dysfunctional. So that's where cannabis can help us forget. If my PSD starts to flare, I want to try to break the cycle of that before it becomes too severe. So that's an example of, I'm a Pennsylvania patient, and one of my qualifying condition. So So the short-term memory loss, which is not good if you're studying for an exam, it's a side effect, but it's very beneficial if you want to have short-term memory loss if PTSD or anxiety are flaring. Likewise, eating. We can eat to excess, or we can have insufficient food, anorexia, potentially even malnutrition. So the endocannabinoid system in cannabis can help regulate that. Next slide, please. Showing some of the neurotransmitters affected by the endocannabinoid system and any disease that is involved in one of these neurotransmitters. For example, depression is associated with serotonin, schizophrenia with dopamine, addiction with dopamine. In theory, any of these conditions can be impacted through the endocannabinoid system in cannabis. Next slide, please. Some examples of the medical literature. U.S. states that allow medical marijuana see a drop in other prescriptions. Yes! All right, next slide, please. This is an amazing study from Canada. Substituting cannabis for prescription drugs, alcohol, and other substances among medical cannabis patients. 87% of Canadian medical patients substituted for cannabis for either a prescription drug, which was 80% substituted for a prescription drug, which could be prescription opioids or benzos or antidepressants, 52% for alcohol, and 33% for illicit substances. The main issue was affording adequate cannabis for substitution for prescription drugs, and those under 40 were more likely to substitute for all three. Amazing study. Dr. Levine, our Secretary of Health, was very impressed with this because we're the only state that has cannabis for opioid use disorder. Okay, next slide, please. Cannabidiol can inhibit the reward facilitating effects of morphine. Well, one of the measures of addiction is how rewarding, how good it feels. So for morphine or heroin, it feels so good, people just want to do it again. So if cannabidiol can blunt that pleasure feeling, it makes opioids, or in this case morphine, less attractive. Now this was a rat study. So the question is, how applicable is this to humans? Well, let's go find out. Next study. So let's go see what Madison said. Cannabis, let's see what Madison said in 1891. Let's go backwards in time. Experience with hemp goes back a decade. It is proper to state that cases have been habitués or ex-habitués of opium or cocaine. In these, it has proved an efficient substitute for the poppy. That's opium, right? Heroin. Its power in this regard has sometimes surprised me. A naval surgeon injecting 10 grains daily recovered with less than a dozen doses of cannabis extract. And Birch, 1890, same book. Immediate appeasement of the appetite for opium. Now, the cannabis of that era contained more CBD than cannabis does today. So whether it's CBD or THC, I have no idea. But this is not something that was not known to medicine. We're just discovering the past. Next slide, please. So now I'm going to introduce some of the real modern theories of addiction. Ken Blanc, addiction reward deficiency syndrome. there are biological rewards that underline substance addiction and all addictive behaviors. A deficiency, low dopamine, results from genetics, stressors, and adverse effects of prolonged substance use. Next slide. To feel ordinary pleasure, interactions of neurotransmitters regulate dopamine activity in the mesolimbic system, particularly the nucleus accumbens. Individuals who lack ordinary pleasure in their lives are predisposed to use any means or substance to activate dopamine release, relieve stress, and feel healthy, whole, and have pleasure. So I had my addiction genetics studied. I was not surprised because it confirmed everything that I knew, but then told me so much more. What were my specific addiction genes? And it recommended specific nutritional therapies, which also helped with my food cravings. And it also took the onus off of me as something morally wrong, whatever. I have some genetic issues which make me increasingly susceptible to certain substances. So for those who have or suspect this, I highly recommend addiction genetics and potentially the solutions, the nutrition, because it helps regulate dopamine. Next slide. So the genetic addiction risk profile, which I had mine done, then precision addiction management, the neuronutrients, along with talk therapies and yoga and other support, help regulate dopamine, help balance, and help give me a better quality of life. It also helps prevent relapse. Okay, next slide, please. So food increases dopamine or pleasure chemical. Cocaine just dumps out dopamine. That's why you have the euphoria. Music, sex also help with dopamine. Next slide, please. Methamphetamines. Look how the brain burns out of dopamine. So these people become miserable, can't experience any pleasure, years to recover the brain function. Next slide, please. What are risk factors for addiction? No surprises here. I added at the bottom certain of the genetics. There are 21 genes that have been found. And then is cannabis a protective factor? I think yes. Next slide, please. So is cannabis opioid sparing? Yeah, because the cannabinoid and the mu-opioid receptors co-localize and can support each other. Next slide, please. Acute administration of THC leads to endogenous opioid release. So it helps the body make its own endorphins, feel-good chemicals. And chronic THC upregulates the genes which makes our own endogenous opioids. So we feel good naturally. So that's some support for cannabis as a treatment for opioid addiction. Next slide, please. Is cannabis addictive? Well, the best study came from 1944 New York Academy of Medicine. Smoking marijuana does not lead to addiction in the medical sense of the word. So can cannabis be addictive? For some, yes, but not in the traditional sense. This was recognized very early on. It does not lead to heroin or morphine or cocaine addiction, and no effort is made to create a market for this. It's not a stepping stone. It's actually an exit charge. Next slide. So, the middle publication shows heroin addicts who had access to cannabis used between 1/3 and 1/2 less heroin if they used cannabis within the last 30 days. Clearly harm reduction. This is amazing public health information. Next slide, please. So some of my original theories, addiction, this is not original. Addiction is the only disease for which recovery leaves you better off than when you began to be sick. Very interesting concept. It's holistic, it's safer. My research now is CBD relieves daytime anxiety and brain inflammation. And whatever our issues are to transcend X, we can use cannabis to pray, engage, relax, enjoy, socialize, reframe, engage in therapy, work through the trauma. I think THC, particularly if it's an indica, body relaxing, with CBN, which is sleep inducing, or certain terpenes, myrcene, limonene, and linalool can help quiet the mind and are good for sleeping. THC or CBD can, for some people, help them enjoy yoga, get into yoga stretches a little bit better, get an extra dopamine boost. CBD can reduce drug cravings, certainly works for my food cravings. THC can be used during the acute opioid experience to relieve withdrawal, going back to the 1890s. It can be used as part of a detox and a maintenance regimen. And it's a substitute. It's a safer high. It's harm reduction. It regulates the endocannabinoid system. And it doesn't numb, unlike narcotics and unlike alcohol and benzos that numb. Cannabis can provide insights and can open one up to discussion and socializing versus isolation. Next slide. So some recovery tools act as if a higher power embraces and loves you. That's the essence of the 12-step program. Provide service to others rather than self-obsession. Avoid extremism. It doesn't matter what you feel passionate about. Focus on what you need to do in your life today. You know, don't let what you think about the president interfere with getting to work on time tomorrow. Okay, keep it cool. I think healthy diet, exercise, weight's important, adequate sleep, healthy touch, healthy sex. It can be so centering and could be really the beginnings of therapy and a lot of exploration that can be done with cannabis and sexuality. I'll just point out here that people who use cannabis tend to have about 10% more sex, and that could either be good or bad. If you don't want it to be dangerous, risky, diseases or unwanted pregnancy. Do want it to be bonding, therapeutic, loving, engaging, leading to perhaps discussions and working through inner issues with loved ones or trusted ones, but that's beyond the scope of this presentation. Daily fresh air, nature is therapy. Always flip resentments to gratitude, so if I find myself, oh my God, I hit my first red light, I have 5 red lights coming up now. And that's a resentment. No, I am so glad I'm not colorblind, I can see red. I am so glad I have a car. I am so glad I live in a prosperous country that has so many cars on the road. Would I rather be driving in Afghanistan and not have a red light? Would I rather be driving in Syria and dysfunctional traffic lights? I don't think so. So that's flipping a resentment to a gratitude. You can't control others, so stop trying. The only person you can work with is yourself. Try to keep things simple, don't take on too much. Pulse. Don't get too hungry, angry, lonely, tired, or stressed. Ego. Don't edge God out. Don't get too in love and enthralled with yourself. The world can exist without me. The world cannot exist without God. I am not really that critical. Humility. Humility. That's so important in dealing with addiction. Find transcendence and meaning. Something happened. It happened with God's knowledge. What is the message there? What can I learn from it? I could tell you the most traumatic low point of my life that I thought was the end of my life psychologically turned out to be the stepping stone to the heights that I am climbing to this day. It's called, in Jewish spirituality, descent for the purpose of ascent. It's how you frame it. Cannabis could help us reframe. Instead of being so totally stuck on, this is what happened, this was my trauma, I have tremendous anger, I want to kill the people who did this to me. You can carry that anger and you're going to just get more and more into your addiction, or you can somehow work it through, transcend it, understand it in a different way, and your whole life changes and joy emerges and your heart opens. The choice is yours, the choice is ours. We're responsible for our efforts. God's responsible for the outcome. So let's not get hung up on outcome. Let's just make our own efforts. Next slide, please. I think next is my last one. So opioid and other addicts might need 3 to 6 times as much cannabis as others. Don't be afraid of high doses of cannabis. Is this something new? No, it's from the 1891 article in this book. Okay, people with addiction have low dopamine. They may need much higher low doses of cannabis. It's okay. Better cannabis than something more dangerous. It's that simple. Cannabis can be, target at least for people with chronic pain who do take opioids. Target at least a 25%, perhaps a 50% or 100% reduction, but at least a 25% reduction in opioids. Now, codeine, which is a very weak opioid that may not work by itself, with cannabis may be sufficient. Low doses of codeine, like 15 milligrams twice a day, with cannabis may be sufficient for chronic pain and will not lead to opioid addiction. But without cannabis, that would be insufficient, and then a harder drug like oxycodone would be needed. Anybody here of Hyla Cass or the book The Addicted Brain? Yes? Great, I'm meeting with her after this meeting, and we presented together Green Flower Media. The Addicted Brain is her book on addiction. It's all about addiction as inflammation and lack of adequate nutrition. It's a holistic therapy for addiction and understanding addiction in a completely different way, that the brain is inflamed because of inadequate nutrition, and so paying attention to food and to supplements and to relaxation is such an important component of treating addiction. That's her theory, and she's updating the book after she had an extensive discussion with me. She's updating her book in the next few months to have a new chapter on CBD. Cannabis can be used for withdrawal pains. It can be used to reduce opioid and other cravings. Certainly CBD works in my food cravings. It reduces relapse risk. It can provide spiritual insights versus everything else. The other drugs, alcohol, benzos, and sleeping pills and opioids, which just tend to numb. Opioids are a wonderful warm numbing blanket, except with chronic use, all the toxicities take over, and even with acute use, there's a risk of overdose and respiratory depression. I highly recommend for those at relapse risk understanding Ken Blum's work and his genetics, and cannabis is a safer substitute for hard drugs. So I thank you very much. I'll be around till mid-afternoon, and I have to go pick up Hyla in New Jersey.